Hi, my name is Emmanuel and I'm a graduate student at the Bloomberg School of Public Health and the Career Business School.
What did you study during your undergraduate education?
So I actually came from Nigeria. I did my pre-med and went to med school in Nigeria. So I was trained as a physician in Nigeria, basically.
Were you part of any student organizations during your time there?
Oh yeah, I did quite a lot of that. I was very much involved in my medical student association, Ilorin University Medical Students Association, Ilom Salbak in Nigeria, as well as the Nigerian Medical Students Association, which is like the national body of medical students in Nigeria. And also, quite interestingly, I was the first person to be elected executive president of my university student union as a medical student. Kind of had the opportunity to lead the union for of about 45,000 students, and that was really like one of the biggest things I've done in my life.
That's so cool. What are your current research interests and what motivated you to focus on these areas?
So I am very much interested in the intersection of policy, health disparities, and business. Kind of really looking into how policies perpetrate or break the cycles of health disparities in our societies, and how businesses respond to that, because in the end it is businesses that deliver healthcare, and so I'm really very much interested in how they also respond to those policies that kind of shape the health disparities that we have.
Very cool. What impact do you hope your research will have?
I've always looked forward to a world where people are treated equally, where everyone has equal access to healthcare and equal opportunities within the healthcare system, wherever they are, and irrespective of who they are, how they choose to express themselves, or what it is that they possess. And I really look forward to a world where I do the kind of work that inspires and directs policy actions globally, where governments and policy stakeholders can really make policies that promote health for all and ensure that everyone just lives a really healthy life.
Neat. I'm sure a lot of people share the same passions. Okay, I'm gonna backtrack for a second. Could you tell me more about becoming the executive president of your student union?
So basically, the way universities are organized in Nigeria, each university is a big, school that has different faculties within it. So like, I was president of the student union of the entire university. So like, it was all schools combined, about 15 in one, and that had like so many students, and it was really like the first time that a medical student rose to that occasion, and so it was really like a big deal, leading this organization of almost 5,000 people. It was more like a community.
How did you end up in that position?
Well, I would say I've always been interested in politics. I believe strongly that politics shapes our experiences as a people. It really determines what we get and what we do not get within a society. And I just always have been the kind of person who never wanted to stay on the sideline and see people decide what happens to me. And there were issues back then in my university that I really thought I could lead the students through, and so I was really inspired to take the bull by the horn, not wait on the sideline, be in the forefront of that change that I wanted to see. And looking back, I think I did my best.
Cool. So I guess you were elected, or you kind of just like volunteered?
Oh, so it was an elected position.
Okay.
I ran in a very strongly contested election with 4 other persons. Had over 6,000 votes, thereabout.
Okay, very cool. Can you give me an overview of what you do as a graduate research assistant for the Center for Health Disparities Solutions?
I had known about the center before I came to Hopkins, and I was quite attracted to the kind of work that's being done, particularly when it comes to, studying the relationships between place-based disparities and healthcare generally. And I love how the center defines disparities really. Since I joined the center, my work has really been in kind of supporting the work that's being done, which is really huge work, in all of the studies that we do, all of the programs that we organize, basically in researching about policies, how they affect healthcare, especially those that have to do with place-based disparities, like I mentioned, as well as ensuring that those policies are heard by those who have the power to make the change. Quite very interestingly, one of the things I did was being part of the team that planned, the Hope Challenge, health opportunities for policy equity. It was really one of the best things I did while I was here. Kind of really looking into how, as academics, we communicate with people in communities, policymakers, stakeholders in communities, to not just have results from the research that we do, but also to be able to communicate those to people outside, to say, look, this is what the issue is, and these are the things that need to be done. And that's really the kind of thing I've done over the past 2 years, which I'm quite excited about. Working with everybody at the center has been really, really inspiring, and has really supported me towards my own career goals as well.
What is one insight you've come across during your research?
I think one thing I've come to realize over the past 2 years, which I really do understand better now, is that disparities happen everywhere, right? Before I came to the United States, I was deeply concerned about the disparities in healthcare within Africa. They were in different domains. Most of the disparities we have in Africa are really socioeconomic disparities, but they are really strong. And what I then found out coming here is that these disparities occur everywhere in the world. It doesn't matter where you live, whether you're in Africa or Europe or even here in the United States. It's really that disparities exist. The mechanisms through which they exist are different across board. You have some places where like it's really a socioeconomic thing. In some other places it's about race, color. Some other places about where people live, it's about how they choose to express themselves. But one thing I've come to appreciate is that irrespective of how what mechanisms disparities are being perpetuated, they are real, right? And they exist. And we must, as public health professionals, be very, very concerned about how to solve those disparities. So it doesn't matter what mechanisms they happen through, but more like our work is on solving them, identifying the sources of the disparities, and really focusing our work on how they get solved.
How did you become a health policy fellow at the Maryland General Assembly?
So the Health Policy Institute, that fellowship is run by the Bloomberg School of Public Health, and I knew about it since I got to this school in 2023. Kind of like prepared my mind to be a part of it in the second year of my program, and there was a call for application. I applied, chose the offices that I was interested in. We were asked to rank 3 offices. I did choose them. Subsequently, I was invited to interviews. And then after the interviews, I was matched, to be with Delegate Jocelyn Penyam, such a really fantastic woman, which is the chairperson of the Health and Government Operations Committee of the House of Delegates at the Maryland General Assembly. So,
neat. Yesterday, you witnessed the governor, president of the Maryland Senate, speaker of the Maryland House, and other state leaders sign several public health-focused bills into law, including one of the 3 core bills you worked on during this legislative session. Could you tell me more about the bill and how you ended up working on it?
I specifically requested to be in the Insurance and Pharmaceuticals subcommittee, which I was then placed, and all of the 3 bills that I worked on, I worked on quite a lot of bills, but all of the 3 bills I really, really worked very deeply on were like health insurance focused bill. That bill that you're talking about is House Bill 1045. It's basically a bill that came up to protect Maryland citizens against whatever might be happening at the federal level, just because of the kind of times that we are in. Really protecting citizens of Maryland against any changes that might happen at the federal level when it comes to particularly issues of family planning, gender affirming care, and related issues. And it was really a bill that we looked critically in, did research on where the disparities are in these issues, how the kind of amount of people that can be affected if there's any change at the federal level that threatens that. So really, it was a bill that sought to protect Maryland citizens against any changes at the federal level when it comes to any of those issues I mentioned.
Very important, and I'm glad that it got signed into law, I guess, yesterday. Very cool. What do your parents think of your current career path?
Well, I mean, I hope they're happy with me. Again, I would always talk about growing up in Nigeria, but as someone who grew up in Nigeria, most of my parents really wanted us to be, professionals, whether you're a doctor, a lawyer, or something like that. And for me, I really made my parents proud becoming a doctor, and I'm sure they really were looking forward to me, being, deeply involved in the clinical practice. But in my fourth year of medical school, I came into the conclusion that it wasn't something I was, interested in doing. And that was because I was seeing situations where people were dying, people were coming to our hospitals and dying, not because, there were not enough professionals to take care of them, but because there were systemic issues that were threatening their care. And, I just really wondered why people needed to go through that, why people are up to, fall sick in the first place, before they even have complications. And so I decided I wanted to be involved in more systemic issues, policy, health financing, how the system is organized. And that's what I've been doing since I left medical school. I've been involved in different things from health policy, particularly with regards to health insurance, both in Africa, and now that's what I also do here. I really hope they are proud of me, right? And I think they are. But I know that for one, it took them time to process the fact that they have this son who is a medical doctor, trained and licensed, but then decided willingly not to practice. I know it was really not something easy for them to take initially, but I think over time they see the kind of things I do, and I think they're really proud.
I can definitely relate to that as a fellow Nigerian. My parents also really want me to be a doctor. But yeah, I agree. It's interesting seeing how things work, and like sometimes you just can't help but want to do something more, or just
Yeah.
like it's hard to, I don't know how to put it into words, but yeah, like I guess some people gravitate towards doing like the nitty gritty work that needs to be done day to day, and then some people gravitate towards like big picture stuff such as policy and like the upstream factors that lead to the issues.
To the issues, yeah. I don't know why. Like from my fourth year, I just really lost interest. I don't know. I was seeing people, back in Nigeria, really, people were dying for basic things. I saw people die because they could not afford, medicines that were as little as $1 when converted to naira. And I was really devastated the bulk of the times. And so I just knew I wanted to be a part of that bigger level change. So I'm proud of what I'm doing so far, and really excited about what is to come.
When you're not working, what do you like to do to decompress?
Afrobeats. I do Afrobeats. I listen to a lot of music, from Afrobeats to Amapiano, everything African, right? So I do a lot of that, and that's how I relax. I also, like, in most of my spare time, organize parties, for most of the people in our African community around here. So that's really one thing I do almost all the time to decompress.
Cool. I'm gonna need an invite to the next party. Okay, our last question. What would you say to an undergraduate student considering a career in public health?
You see, the issues that we're deeply concerned about, because I know that for all of us who are passionate about public health, is because we're concerned about certain issues. Those issues exist for real, right? The problems in public health exist. Research shows it. Our daily lived experiences, show that those issues exist, and they exist not just here; they exist everywhere. Just like I mentioned, from Africa to Europe to Australia to wherever you are, to the United States, those issues exist, and our work has potential to truly change those issues. The kind of work we do has deep potentials, and the power to make change that is positive and that is effective across board. And so my advice to any young person considering a future in public health is that there's a place for them to make changes, right? There's a place for them to be a part of those who would be instrumental to breaking those deep cycles that have continued to exist in our society, the things that have affected people from obtaining healthcare, from living healthy lives, from living meaningful lives. Those problems exist, and we have that potential to change. And so every young person should always remember that. And I think that should really inspire them to push through all of the challenges And just like we see currently, there's always going to be challenges, right? The work we do is not one that would always go, in a straight line. There's going to be a lot of challenges that we'll face, but the hope and the understanding that what we do can eventually make that change should push them through, overcoming those challenges. And eventually, they would be glad that, they did not give up.
That's a great note to end on. Thanks for meeting with me today.
Thank you.